Hi, welcome to the Larson Health Podcast. I'm Kim Larson, owner of LarsonBotanicals.com and LarsonNutrition.com. Today, I want to talk to you about women post-menopause who are still on hormone replacement therapy, HRT. So guess what I hear almost every week now? Some version of, Kim, I'm late 50s, 60s, something, and I've been on hormone therapy since menopause, and my doctor wants me to stop just because of my age. Is that right? And here's the thing that frustrates me, and it's exactly why I wanted to do a whole episode on this. For years, women were handed a rule that sounded official, but was really just a number on a calendar. Hit a certain age and you're done. Time to come off your hormones, no matter how you feel, no matter when you started or why you started, or what your actual risks look like. That rule is falling apart. The research has moved. And most of the conversation you'll hear out there, even from well-meaning people, is missing the single most important distinction in this entire topic. It's the difference between starting hormone therapy late and starting on hormone therapy you began years ago. Or I'm sorry, not starting, but staying on hormone therapy you began years ago. And those are two completely different stories with two completely different risk pictures. And almost nobody is explaining that clearly. So today we're going to fix that. We're going to walk through what the newest 2026 research really found, who it applies to, where the genuine cautions are, and because this is what I do, where your food, your movement, and your daily choices actually move the needle on risks that matter. So let's get into it. Before we dive in, a quick word about where you can keep learning about after this episode ends. Everything we talk about here, heart health, blood pressure, metabolic markers, hormones, I write about this in much more depth over at LarsonNutrition.com. The blog is where I unpack the science in plain language pieces on heart disease, the truth about high blood pressure, microplastics, and how to support your body's natural detox. Maybe strength training that actually works, and the cellular energy story behind healthy aging. And if you're thinking, okay, Kim, but what do I actually eat? That's covered there too. The recipe section is full of the real doable meals my clients use every day. Think a protein-packed apple pie yogurt bowl, a creamy chocolate chia shake, a peach strawberry cottage cheese bowl, a breakfast chicken scramble. Food that keeps your blood sugar steady and your energy up without a culinary degree or 2 hours in the kitchen. I really go for super easy recipes. Some of them have a lot of ingredients, some of them don't. So after this episode, head to LarsonNutrition.com, click on blog or recipes and bookmark it. It's free, it's evidence-based, and it's the same library I send my coaching clients to, and that's LarsonNutrition.com. Okay, so let's talk about hormones. If you've been listening for a while, you know I came to this work the hard way. I walked into my doctor's office at 53 thinking I was just there for a routine checkup. I knew I had gained some weight, like 45 pounds of weight during COVID, and also I learned high triglycerides, high blood pressure, and prediabetes staring back at me from the lab report. I reversed all three through proper nutrition. And that's the lens I bring to everything, including this episode. So I want to be crystal clear about something right at the top. And I'm going to say it again at the end because it matters that much. I am a nutrition coach, not a physician. Nothing in this episode is a prescription, and nothing here tells you to start, stop, or change your hormone therapy. Those decisions belong to you and the clinician who actually knows your history. What I'm giving you today is the map, so that when you sit down with your provider, you're walking in informed, asking sharper questions, and not getting brushed off with a number. Because here's why this is suddenly like everywhere, right? Women's longevity is the health story of the year. The big wellness forecast for 2026 all landed on the same idea that women age differently than men, that the ovary acts like a kind of command center for women's health, and that the medical world is finally building research and protocols designed for women instead of borrowed from studies done on men. So many studies are done on men and not enough on women, but this one was on women. Hormone therapy is right in the middle of that conversation, being reframed by some as longevity medicine. That reframing is exciting. It's also where a lot of half-truths are creeping in. So let's separate what the evidence actually supports from what's getting covered. So let's start with the headline, because it's genuinely good news for a lot of women. For years, the working assumption was that 65 was a kind of a cliff. You'd been on hormone therapy, you'd crossed that age, and the message was time to stop, full stop, no nuance. That cliff is gone. The major professional body in this space, the Menopause Society, has made clear that there is no universal age limit for staying on hormone therapy. Their position is that for healthy women with persistent, bothersome symptoms, continuing past 65 can be a reasonable option, as long as it's done thoughtfully, with a careful weighing of risks and benefits, the right dose and the right formulation, and regular check-ins to assess as things change. And this isn't theoretical. When researchers actually looked at real-world use, they found it's not unusual for women in their 70s, even women as old as 80, to still be getting real benefit from hormone therapy. And I found this to be very interesting, because I was thinking, like, I need to get off of HRT, right? I'm 58 years old. It's about that time. I'm sleeping well. I don't have any hot flashes anymore. I have no pain. I have nothing going on. But then I was off of it for about a week and started having some troubles with sleeping. So I'm reconsidering going back on, but when I'm not having my snoring husband next to me, I sleep just fine. So, because here's a fact that surprises people. Hot flashes and night sweats don't politely wrap up a tidy expiration date. The average woman has them for somewhere between 7 and 11 years. I know my mother went through it for at least 11 years, and a meaningful chunk of women are still dealing with them well into their 60s and beyond. I don't have any hot flashes, thank God, unless I'm working hard on, working out, or, and then I'm getting heated up or hiking up a hill. So if your symptoms are still real, the idea that the calendar alone should decide your treatment just doesn't hold up. So why do so many women, and honestly so many doctors, believe in the age 65 cliff? It traces back to studies from the early 2000s that set off real alarm bells about hormone therapy and raised fears about breast cancer, heart disease, and stroke. And those fears drove a generation of women off their hormones almost overnight. But in the 2 decades since, our understanding has gotten a lot more sophisticated. We've learned that the type of hormone, the dose, the route, whether it's a pill versus a patch, and crucially, the timing of when you start, all dramatically change the risk picture. It was never one monolithic thing called hormones. That was either good or bad. And the details matter enormously. So, which brings us to the most important detail of all. If you take one thing from this whole episode, make it this. There is a world of difference between a woman who started hormone therapy around the time menopause and has simply stayed on it, starting fresh at 65 or older, having been off hormones for years. The research treats these as two very different situations, and you should too. This is sometimes called the timing hypothesis, and the idea is intuitive once you hear it. Estrogen seems to behave, very differently in a body depending on when you introduce it. Start near menopause while the cardiovascular system and other tissues are still relatively estrogen adapted, and the profile tends to look more favorable. But introduce it years later into a body that's been without it for a long stretch, into blood vessels that have already changed, and you can't actually tip some risks the wrong way. So picture two women. The first went on hormone therapy at, say, 51 or 50 or 49 or 52, 53. When her period stopped and her hot flashes were wrecking her sleep, and she's been on a steady, appropriate dose ever since, maybe she's now 60 something, right? The second woman stopped hormones years ago or never took them, and at 67, she's considering starting for the first time. Same age today, completely different risk conversations. The first woman is a long-term continuer. The second is a late initiator, and the newest research is very clear that those two are not interchangeable. So why does this matter so much in practice? Because a lot of women, and frankly, a lot of providers, collapse these two situations into one. A woman who's done beautifully on a low dose for 15 years gets told she has to quit because of a headline that was really about the risks of starting late. That's not careful medicine. That's a number on a chart making a decision that should be made by looking at the actual person. Now, I want to be fair and honest here because that's the whole point of the show. Being a long-term continuer is the more reassuring category, but it is not a free pass. There's still a real factor we have to talk about, and that's what happens over time with duration. So let's go straight to the newest, biggest study and see exactly what it found. But first, let's take a quick break, and I want to talk to you about something that connects directly to a theme that runs underneath this entire hormone conversation. What you're putting on your body, not just into it. Here's something I think about a lot, and it ties right into today's topic. We spend all this energy worrying about what we eat, and we should, but we forget that our skin is our largest organ, and it absorbs what we put on it. When we talk about hormones, about endocrine disruptors, about lowering the chemical load our bodies have to deal with, your daily skincare routine is part of that story. That's exactly why I created Larson Botanicals, my organic skincare line made with clean, thoughtfully sourced ingredients and nothing you need, a chemistry degree to pronounce. No mystery fragrances, no junk. Just real botanicals that respect your skin and your body's chemistry. I'm especially excited about the Advanced Bioactive line. Skin longevity is one of the biggest movements in wellness right now. And the shift from chasing anti-aging gimmicks to actually supporting the skin's health and function over the long haul. That's the philosophy behind the Bioactive line. It's active, results-driven botanical formulas designed to support your skin as it ages, the way good nutrition supports the rest of you, right? I mean, my skin has literally changed since using the Advanced Bioactive, and I swear my skin is looking younger and younger every week. And because a healthy home matters too, the line includes all organic candles, clean, burning, naturally scented. None of these synthetic fragrance loads that so many conventional candles quietly put into your air. Come see the whole collection at larsonbotanicals.com. There's clean skincare, clean candles made by someone who actually cares what's in them. That's larsonbotanicals.com. Now back to the study. In February of 2026, a large study was published in Menopause, which is the journal of the Menopause Society. And this one's worth paying attention to because of its size and scope. More than 83,000 women aged 50 and up followed over a 22-year span. The researchers sorted women by the age at which they started hormone therapy and then tracked outcomes that actually matter to all of us. cancers, cardiovascular events, osteoporosis, and dementia. And what did they find? Let me give it to you straight, the good and the cautionary, because you deserve the real picture. First, the late initiation finding, which lines up with that timing hypothesis we just talked about. When women started hormone therapy at 65 or older, the analysis found increased risk of cancer overall, of stroke, and of ischemic heart disease and heart attack. So starting brand new at that age genuinely carries more risk. That's the cautionary headline, and it's real. Second, and this is important for the long-term continuer, there was a signal in the raw numbers that women who started between 50 and 65 had lower rates of certain heart problems. Although I have to be honest with you, that apparent heart advantage shrank once the researchers adjusted for other factors. So I'm not going to oversell it. What I'll say is that starting in that earlier window did not show the same elevated cardiovascular danger that starting late did. Third, and here's the piece every long-term user needs to hear. The study found that longer duration of hormone therapy use was associated with higher overall morbidity. In plain English, the longer exposure, the more cumulative burden adds up, especially when it comes to certain cancers, the breast cancer in particular. That's not a reason to panic. It's not a reason to quit tomorrow, but it is a reason to keep reassessing rather than just coasting on autopilot for 15 years without ever revisiting the conversation. Now, the researchers themselves were careful, and I'm going to be careful right along with them. This was an observational study, which means it can show associations, but it can't prove cause and effect. And it had real limitations, notably. It didn't capture the formulation each woman used, the dose, the route, or whether estrogen was being taken with a progesterone. And those details, as we've said, change everything, which leads to the practical takeaway. And it's the same one the experts landed on. There's no universal stop date. And the right move is a personalized risk-benefit assessment with regular reassessments as you age. It's not a cliff, a conversation that gets revisited. Now, let me make this concrete because it depends, right? It depends. It's useless without specifics. So here are the variables that actually shift the risk picture and the ones worth knowing about your own regimen. So route of delivery. This is a big one. Lower dose estrogen delivered through the skin, a patch or a gel, generally carries a more favorable risk profile than estrogen taken orally, particularly when it comes to blood clots and stroke. And localized vaginal estrogen, used just for vaginal and urinary symptoms, is a different and very low risk category altogether. So hormone therapy isn't one thing. A low dose patch or an oral combined pill are not the same animal. Dose. The common approach for women continuing into their later years is often described as low and slow. The lowest effective dose that keeps symptoms manageable rather than more than you need. Estrogen alone versus estrogen plus a progesterone. If a woman still has her uterus, she's typically given a progesterone along with estrogen to protect the uterine lining if she's had a hysterectomy. Or if she's had a hysterectomy, estrogen only may be on the table. And this distinction matters because a lot of the duration-related breast cancer signal is tied more to combined therapy than to estrogen alone. So when you have this conversation with your provider, you're not asking a yes or no question. You're asking, given my history, is my route, my dose, my formulation still the right fit for where I am now? I promised we'd separate the evidence from the hype, so let's do that. Because this is where I see women getting led astray right now. The wellness world has discovered hormone therapy and is busy rebranding it as longevity medicine. The secret to aging slower, protecting your brain, staying youthful. And I understand the appeal. After decades of women's symptoms being dismissed, it feels validating to hear hormones described as powerful and worth taking seriously. There's a real legitimate core here. Women's health has been understudied. Hormones are genuinely impactful, and the renewed research attention is overdue and welcome. But here's where I have to put on my evidence hat and be the honest friend. The data does not support using hormone therapy as a general anti-aging tool. And it specifically does not support taking it to prevent cognitive decline or dementia. In fact, the guidance is explicit that hormone therapy is not recommended to prevent or treat dementia. And remember that timing hypothesis. The same use look, more favorable, suggests that starting hormones late in hopes of protecting your brain may offer no benefit and could even harm you. So if anyone is telling you to start hormones in your late 60s to keep your mind sharp, that is getting ahead of the evidence. And if you are having symptoms and you're on HRT and somebody is telling you that you need to go for psychiatric help, you need to change your doctor. A lot of these doctors do not understand that women are going through menopause. And when they do, they have a lot of shifts from their hormones that are causing us to have brain fog or have other things going on. And so their thought is that, you know what, you need to go get on some antidepressive medications or craziness. I'm telling you, do not fall for anything like that. If somebody tells you that, that is baloney. You don't need that. Get some sunshine, get your feet on the grass in the summertime, walk barefoot outside, and get some sunshine every morning before 9 a.m., after 4 p.m., get your sunshine, get your circadian rhythm going, go for a walk, at least 30 minutes, get your sunshine. So this is the gap between the trend and the science. The trend says hormones are longevity medicine. The more, the better. Age is just a number. The science says something much more measured. For the right woman, starting at the right time, at the right dose and route, hormone therapy can meaningfully improve quality of life and may carry some benefits. But it is a personalized medical decision with real trade-offs. It's not a fountain of youth you bolt on for general anti-aging. I'd rather you be the woman in the room who understands the difference. Because being precise about this isn't being negative. It's being powerful. It's how you make a decision that's actually right for your body instead of getting swept up in a headline. Let's take one more quick break, and then I want to spend real time in the part that's genuinely in my wheelhouse. The things you control that move these risks, no prescription required. Speaking of lowering your chemical load, I've got some brand new arrivals at Larson Botanicals I'm genuinely thrilled about, and they could not be more on theme for this episode. First, I have a mineral sun care. Summer's here, and protecting your skin matters. But you don't have to choose between sun protection and clean ingredients. Our mineral sun care, it's not a sunscreen, uses physical mineral-based protection. No chemical fillers, just clean, effective coverage you can feel good about putting on every single day. It has beeswax, shea butter, cocoa butter, non-nano titanium, zinc oxide. I do have some with non-nano titanium dioxide for those people who really burn. Put it on your shoulders, your hands. Non-nano means it's not going to absorb into the skin. It's going to sit on top. But the non-nano titanium dioxide does give you a white cast. You really have to rub it in to get rid of it, but it really protects against the sun. Second, and this one's a personal favorite living up here in the North Woods, is my woodland bug protection. This is amazing. I was at a concert event this past weekend and not a single bug bit me. wearing this woodland bug protection. Other people are using it just because it is so rich with moisture and took away ashy skin, ashy, flaky, dry skin. It's a botanical, naturally derived bug repellent that actually lets you enjoy being outside without dousing yourself with harsh chemicals. There's no DEET in it. It's a balm. So it's a lotion that you put on. You can put it on your face. It's got all organic citronella and lemongrass and lavender and geranium oil. It's amazing. It smells wonderful. People love it. Think about hikes and the garden evenings on the porch, covered cleanly. And third, something everybody asks me about is clean deodorant. Now I have it in 3 scents. It's aluminum free, made with botanicals, beeswax, shea butter, cocoa butter, jojoba oil, and finally available in options so you can pick the one that's you. There's 3 scents. There's Dirty Hippie, which is a fun one if you like patchouli. There is Orange Whip, which is orange and vanilla. And then there's the Woods with cedar wood. And if you like the woodsy smell. So they're all clean and all effective. So there's Mineral Sun Care. There's the Woodland Bug Protection and 3 new deodorant scents, all part of the organic Larson Botanicals family. Stock up for summer at larsonbotanicals.com. That's larsonbotanicals.com. Okay. So now let's talk about what you can do. Here's why I'm so passionate about this part. Everything we've talked about, the breast cancer signal that climbs with duration, the cardiovascular questions, bone health, blood pressure, those are exactly the areas where your daily choices have enormous influence. Hormone therapy is one lever. It is not the only lever. And it's not even the one you hold in your own 2 hands every day. So whether you stay on hormone therapy, taper, switch formulations, or come off entirely, here's where you build your foundation. Because this foundation lowers the very risks that accumulate with age and with long-term hormone use. Protect your breast health through your plate and your habits. Don't be eating highly processed foods and highly, high fructose corn syrup and lots of sugars. Cancer loves sugar. Let me say that again. Cancer loves sugar. Stay away from sugar. If you got hormone problems, stay away from sugar. Protect your breast health through your plate and your habits. The duration-related risk that showed up in the study is real, and it's also one where lifestyle has leverage. Maintaining a healthy body composition, keeping alcohol modest or no alcohol at all, staying physically active, and eating a diet rich in fiber and plants are all associated with lower breast cancer risk. Also, plastics. Don't drink out of plastic water bottles. Get a metal bottle. Fill your metal bottle up. Use that metal bottle. Don't be using plastics. I just see I got a little speck here. It is what it is. Okay. You can't change that. You've been on therapy a long time, but absolutely you can stack the other factors in your favor. Guard your heart and your blood pressure. This is squarely in my wheelhouse. When I reversed my own high blood pressure and high triglycerides, it was through targeted nutrition, not luck. My family, it runs in my family, arthritis, high blood pressure, high triglycerides, cancer, all kinds of things are running in my family. I don't have any of it because I eat clean. Look at my skin. My skin is clean, right? I eat clean ingredients. I drink reverse osmosis water. I put in electrolytes in it. I drink B minerals. I take supplements like Perfect Aminos. Cutting the ultra processed foods that quietly spike blood sugar. Building meals around protein and quality fiber and real ingredients. Think about like broccoli or green beans, black beans, red beans, having a salad every once in a while. I know you're not a rabbit, but God, is it good for you? And put lots of goodness in there, right? Put in some pumpkin seeds, put in some sunflower seeds, organic if you can get it. Put in bell peppers and tomatoes and cucumbers and have some crunch. Put in some, whatever you like. Make it a garbage salad. Put in some feta cheese. Put in some chicken. Put in some salmon. Building meals around protein and fiber and real ingredients, getting your sodium and your stress under control, moving your body daily. These are the things that protect the cardiovascular system. The hormone conversation keeps circling around. Defend your bones, because this is one place hormones were genuinely helping. One real benefit of estrogen is bone protection. So if a woman comes off therapy, bone density becomes something to watch closely. Nutrition carries a lot of weight here. Adequate protein, calcium, and vitamin D. And this is the big one people skip: strength training. Strength training is so essential. In jump training, I used to think like jump training was like, oh no, I got arthritis in my knees. I figured out that an inflammatory diet of highly processed foods and highly processed wheat products caused arthritis in my body. I stopped taking highly processed foods. I stopped taking highly processed wheats, and I no longer have arthritis in my knees and in my neck and in my hands. It's all gone. Get rid of the inflammation and you can help your body heal. Do fasting as well. I do a three-day fast right after the holidays and again after summer. So this is the big one people skip, is strength training, right? I've talked about this on the blog. The research is overwhelming that resistance training is one of the most powerful things a woman can do for her bones and her longevity. If you were rethinking hormones, this is non-negotiable. Pick up something heavy regularly. Do some, like I was carrying this morning. I was doing a what they call a farmer's carry, and I had 35 pounds in each hand, and I held it for over a minute. So that's the real test: is how much can you carry in your hands, in each hand? You should be able to carry your whole body weight. Now, 35 pounds I'm not 70 pounds. So I'm working up towards being able to carry my whole body weight. So I need to be able to have 75 pounds in each hand. I need to have, that's a lot of weight, but that's how you determine your grip strength. Your grip strength is the number one longevity tool that you have, having really good grip strength. So support your body's natural detox with lower toxic load. Get rid of the plastics. Do not microwave in plastic. I don't know how many times I've said this on podcasts, but do not microwave in plastics. Do not eat out of plastics. Do not scrape plastic. That goes into all your food. It's in your brain. It's in your heart. It's in your bloodstream. Get rid of the plastics. We've talked about microplastics and endocrine disruptors on this show before. The chemicals in our food and our water, and yes, our personal care products, all add to the load our hormonal system has to manage. So eating to support your liver so it can detox your body and your gut, drinking clean water, getting enough fiber to actually carry things out, and reducing the chemical inputs you could control. That's all a part of giving your hormonal system a calmer environment to work in. And mind your metabolic markers: blood sugar, insulin, inflammation, body composition. These underline nearly every risk we've discussed today. Keeping them in a healthy range is protective across the board. Hormones or no hormones. This is the heart of the metabolic work I do with clients, and it's the through line of this entire show. Do you see what I'm getting at? The medication question is important, but it's one piece of a much bigger picture. And the bigger picture is mostly built by what you do every day. That's not me minimizing hormone therapy. It's me reminding you of how much power is actually in your hands. Let me speak directly to two women listening right now. The first is the woman who's been on hormone therapy since menopause and is being told to stop purely because of her age. Here's your takeaway. The age cliff is no longer the standard, and you're in the more favorable long-term continuer category, and you're entitled to a real individualized conversation, not a number. Go have that conversation. Bring your specifics. Ask about your route, your dose, and your formulation. Ask what your particular risk-benefit picture looks like, given your history. The second woman is who recently stopped, maybe in the last month or two, and is now wondering if that was the right move. First, please don't restart, change, or adjust anything on your own. Restarting after a break is itself a medical decision, and it should be made with your prescriber, not solo. What I'd encourage you to do is track. Notice what's changed since you stopped. Are the hot flashes back? Is your sleep worse? Is your mood or your joints in pain? Is your mood shifting? Because the quality of your life data in this age range tends to favor women who continue over those who abruptly stop. And your lived experience over these next few weeks is real, useful information to bring to your provider. For both of you, the gold standard is a clinician who actually specializes in menopause. The Menopause Society keeps a directory of certified practitioners. That's the person you want in your corner for this, not a 5-minute conversation squeezed into an unrelated appointment. And here are the questions I'd write down before you go. Why are we making this change? Is it based on my age alone or my actual risk profile? And what formulation, dose, and route am I on? And is it still the best fit given my personal and family history, especially around breast cancer and clotting? What does continuing results stopping look like for me specifically? And how will we monitor and reassess from here? Walk in with those questions and you've changed the whole tenor of the appointment. So let's bring it home. The big shift is that arbitrary age 65 stop date is gone, replaced by individualized, regularly assessed decisions. The distinction that matters most is continuing versus starting. And if you began near menopause and stayed on, you're in the more reassured group. Though duration is still something to keep an eye on, especially for breast health. The newest 2026 research confirms that starting late carries more risk, that longer use adds cumulative burden, and that the answer is always personalization, never a one-size-fits-all rule. And that shiny longevity medicine framing, real at its core, oversold at its edges. Hormones are not a brain protection or anti-aging shortcut, and the evidence is clear on that. But underneath all of it is the message I will never stop repeating on this show. An enormous amount of your health is built by what you do every single day. Your food, your movement, your bones, your blood sugar, your toxic load. Those are yours, and they matter no matter what you and your doctor decide about for your hormones. Now, my required and heartfelt reminder, I'm a nutrition coach, not a physician, and this episode is education, not medical advice. Nothing here is a recommendation to start, stop, or change your hormone therapy. Please make those decisions with a qualified clinician who knows your full history. And if today's episode gave you better questions to ask, it did its job. And before you go, if this resonated, keep the momentum going. Come read the deeper dives and grab some recipes at larsonnutrition.com and treat yourself and your home to clean organic skincare, candles, and our brand new summer line, mineral sun care, woodland bug protection, and 3 new deodorant scents over at larsonbotanicals.com. And if this session helped you, share it with a friend who's navigating this exact decision, because almost nobody is explaining the continuation versus starting difference, and she deserves to hear it. I'm Kim Larson. Take good care of yourself. You're worth it. And see you next week.